We are going to talk about something that affects millions, but many ignore it until it becomes an emergency. It starts as a harmless bulge, and this could turn into a life-threatening bulge in your body. So let's talk about hernias. We are going to look at the types of hernias, the signs that to never ignore, and when it is time to act. So I'm Dr. Joshua Nderitu. I am a family physician. I have interest in public health and cancer prevention and treatment. He thought it was a lump until it turned blue. A 52-year-old man had a groin bulge for months, and it was always there. And one morning, he woke up with a lot of pain. The bulge had become bigger. He couldn't be able to take it back, and he was told it needed emergency surgery to save his life. This was a surprising message to him because he had always had it. He was lucky, but not everybody is lucky. This is not fiction, it is real. Many people ignore hernia until it becomes blocked, or the blood supply from the tissues inside are cut off, and these cuts of the blood supply are causing the tissue in that bulge to die, and this can cause a serious infection and can also cause your gut to block. So it is important to understand what are hernias and also to know what are the dangers of having a hernia and what to do when you have one. So what is a hernia? A hernia is a bulge that happens when the organs push to a place where they don't belong. You may find it in the groin area, in the lower part of the abdomen. You could have it at the belly button, and some of these people are born with them, and they are common. The ones at the belly button are very common in children, but as the children grow, they close up. So what usually happened, there is a weak spot on a muscle, and this makes tissues to try to push through. And so when something beneath your skin is moving in and out, then this could be dangerous because sometimes the tissues can get into that opening, and this could be intestines, could be fat, could be the covering of your belly, and this makes the muscle become weak, and you may not be able to survive that blockage. So there are different types of hernias. As I said, there are those that are found in the groin area, and these are most common in men. There are those that are happening around your belly button, and they are common in babies and also women. You also have a hernia, what we call a hiatal hernia, and this is common. It is inside your stomach when your stomachs keep bulging to the covering that separates the stomach and the abdomen, and the stomach pushes into the chest, and this can lead to a lot of reflux, what many people experience as gastroesophageal reflux disease. If you want to know more about gastroesophageal reflux disease, you can find more information in the overall health YouTube channel. And then you also have femoral hernias. These are bulges that are found on the upper part of the eye, on the inner side, and you can have a bulge that you have coming in and getting out on that region. Then we have what we call incisional hernia. Incisional hernias are bulges that happen after you have had an operation, and then your tissues keep pushing through the incisional site where the surgery had been conducted. Usually what happens is that the wound heals, and the tissues do not connect as good as they should. And so this makes the tissues to keep coming in and coming out. And this can reach a point, especially if the neck or where the tissues are going through is small, then the tissues might be unable to go back. And if that happens, the tissues will have their blood supply cut, they can undergo death, and if part of the intestine is caught in that outpouching, then you may have obstruction of your gut. You may not be able to pass gas. You may not be able to pass stool, and this is a life-threatening condition. Many people walk around with hernias, especially when it is going in and it is getting back. It is not life-threatening. The problem with that is you never know at what time this movement of the tissues, of the organs that are moving in and out, will cease to happen and the organs get blocked. So when you have swelling that is bulging in and out, what should you do, and what are some of the symptoms to watch for? You have a visible bulge. If the pain becomes there when you lift things or when you cough, if you start having a burning or a nicking sensation, if you feel vomiting or you are feeling nauseated, and there is sudden severe pain and the bulge persists, many times you don't know that it goes and comes back. But now, this time round, the pain, the organ does not reduce. It doesn't go back. There is a dull ache. The bulge persists when you cough. These would be warning signs, and the pain will become worse, and the bulge does not go back, and you start vomiting. Then you need help immediately. This is not just your normal hernia. It has gotten obstructed or blocked, and then it is a surgical emergency. When does your hernia need to be operated? It is important that you know this, that when your hernia does not go in and back, then it needs to be operated. So when it is small and painless, then you don't need to do anything. But if it becomes painful and it is increasing in size and it can't go back, then there is a danger. If it is, you can easily get the organs in and out, that is, we say it is reducible, then it is not a danger. But when it becomes irreducible, you can't take it back, then you have a problem. If you have vomiting, you have fever, the swelling is becoming discolored and it is becoming bigger, then you know that you need surgery. Not all hernias need surgery, but when hernias become blocked or strangulated, then they need surgery. So what does the surgery for a hernia look like? It is to relieve you from the risk of obstruction or blockage of the blood supply to the organ that are affected. And so usually the surgery is done as an emergency, or you also can have what we call a code hernia repair, which is alleged. When your hernia is going in and getting out, you can have it planned. So these are planned for surgery, but there are those that are done as emergency. So it's accompanied with a short hospital stay. You can have local or regional anesthesia just covering the area where the hernia is. And then sometimes you may need to have a mesh for reinforcement to prevent a recurrence. So the recovery is in days and weeks. And when you are going through the recovery, you need to have, if you have a cough, it needs to be treated. If avoid lifting heavy weights during the recovery period, so that you can allow your hernia to heal appropriately. So your health is not a burden. So when you have this bulge that is getting in and out occasionally, then you need to have it checked out, and the doctor checks on what is the risk of this hernia obstructing and refusing to be returned back, and then it becomes an emergency. So it is important that you get checked, and if it is a risk, then before it gets into an emergency, be ready to have it repaired in a planned for surgery. It is usually better to have a planned surgery than an emergency because the risk of emergency surgeries is more. The hospital is not quite well prepared. But when you have a planned surgery to repair your hernia, then the doctors plan for it, they get everything ready, and then it can be operated, and obstruction or strangulation is prevented. So remember that hernias are very common, and they can be dangerous when ignored, and when they block or get strangulated, it becomes an emergency. So know the types and the warning signs of a hernia, know when to seek surgery, and know that surgery is safe. It takes a few days, and you can have what we call emergency surgery if your life is at risk, the hernia is blocked, and it can't go back or becomes strangulated, and the important organs are get into the swelling. And so when this happens, then it will be operated as an emergency. But you can also have those planned for surgeries when your doctor sees that you have this bulge that keeps coming and getting out, and it becoming a nuisance. It can be repaired and a mesh put, and then your risk is significantly reduced. And the surgery just takes, recovery takes a few days, and it prevents you from the emergencies, and it saves your life. So if you have a bulge, don't guess, get examined, talk to your doctor, book an appointment with your doctor, and then if you have liked the information in this video, share it with someone whom you think you could help know that they have a problem and it could be checked and treated. And if you have anything that you are unsure of, do not wait until it is an emergency. You should be able to go for medical checkups and know when this is a dangerous lump, or when you may need to wait, and when you need it to have your hernia repaired. So if you like this information, put your comments on the comment section below this video, and also share it within your circles. Also, if you have had a hernia, you had it repaired, share your experiences so that others can also learn from you. Do not wait for emergencies. Have yourself checked to save a life. Thank you, and remember to follow the Overall Health YouTube channel for more life-saving tips. Thank you.